Hi, hello, namaste. Welcome to Misan Health. Today we are here with Dr. Ramakrishna Aradyula garu. He is from Gentleas Pharma Limited and Genurved R&D head. So previous episodes we discussed about arthritis and about Karkarin product. And sir, how it is gonna work on osteoarthritis?
Good question. See, in the last episodes we have discussed, we just gave an introduction about the Karkarin.
Yeah.
Karkarin is our brand. See, incidentally, the meaning of Karkarin is, Karkari means the protector.
Protector.
The protector of Yajnasala.
Okay. It
Yajnamu.
is in Sanskrit?
Sanskrit.
Yeah, okay.
Karkari. Karkari.
Karkari.
A goddess, special goddess devoted to give the protection for the Yajnasala and the total process of Yajna.
Okay.
See, the prajna will continue for 50 days, 60 days, 20 days, like that, and 5 days.
Okay.
So this gives complete protection for that.
Okay.
That means Karkari means it is protection.
Wow.
Incidentally, the product is made up of curcumin. So that is the reason I named it as Karkarin.
Nice.
See, the curcumin is the main component in turmeric.
Okay.
Turmeric, the main component is curcumin. But this curcumin, percentage of curcumin in turmeric is only 5%.
Okay.
But whereas in Karkarin tablet, we are giving 95% curcumin.
How it is gonna possible, sir?
We are extracting the exact ingredient what we require. We got different methodologies, our own patent process.
Okay.
We just extract it from the turmeric and we give that particular curcumin as a tablet form. That is the reason the brand name is Karkarin. Anyway, I'll tell you the other details of this Karkarin tablet also.
Okay.
Today, your question is how it is going to effective or how it is going to be effective in the osteoarthritis. In the last episodes, we discussed about the anti-aging properties of Karkarin.
Yeah.
And in second episode, we discussed about the rheumatoid arthritis. And of course, many episodes we are talking about this Karkarin. And this particular episode, let us devote it for osteoarthritis. Okay. See, basically the osteoarthritis is the degenerative of the bone disease. Nothing but it is an inflammation or infection of the joints because of the degeneration of the bones. See, the bone structure is like that, upper bone and lower bone. There is in between this particular bone, there is a cushion-like structure called cartilage. Okay. That particular cushion gives the leverage to these particular joints or bone to bone, and it avoids the friction between bone to bone. See, if the cushion is removed or cartilage is removed, what will happen? The bones will directly hit one another and the degeneration starts. Okay. It is nothing but the death or inflammation or infection of that particular cartilage. Due to this particular osteoarthritis is the resultant. See, what happens is the quality of the life of the patient or individual is questioned now. Because this osteoarthritis is painful condition where they cannot get up from the bed. And if you sit for longer time in one particular posture, it becomes difficult for you to get up. Okay. So because of these factors, this particular osteoarthritis affects the quality of life and day's work. Okay. See, normally this osteoarthritis occurs after 50 years of the age. But nowadays, younger generation is getting this particular osteoarthritis because of various pollutant foods, environmental pollution, lifestyle changes, and sedentary life, working together only in the chair without exercise, and they don't do any physical activities. These are all the reasons. The people who sit before the computer, they sit 24 hours before the computer. Even the people who are not sitting before computer also, they will sit with cell. See, what happens is your joints are stagnated for longer time, and this particular, besides that, your lifestyle got changed, your food style got changed. See, ever since man, took birth on this particular earth, diseases also took birth. Okay. They are simultaneous. And about this osteoarthritis, it is well discussed in Atharvana Veda. That means this particular subject of arthritis or osteoarthritis is coming from Atharvana Veda. Okay. They discussed about rheumatoid arthritis also. The basic difference between rheumatoid arthritis and osteoarthritis is rheumatoid arthritis is it may occur at the young age also because it is autoimmune disorder. Okay. Whereas osteoarthritis is only because of the degeneration of the bone joints. Okay. This degeneration occurs due to pollution, the food style, lifestyle, and weight. Okay,
so there is no possibility in children?
No, if the child is obese, then he may get it. Because of the weight spells on this particular joints only. Okay. And this joint per joint, it will get distracted and the pain will come. See, normally the symptoms is like this: pain, severe pain of the joints, and swelling, and redness, loss of function of that particular joint, and a light temperature may come to the entire system or that particular affected part. But anyway, these got to be treated. There are several remedies available in the market and prescription drugs are available, but they target only on one particular condition. See, the reasons behind this particular pain, though it is degeneration, there are certain inflammatory mediators which releases in our body. They are the responsible factors for this particular pain. The first and foremost inflammatory mediator is prostaglandins, E2. These prostaglandins are responsible to give you that pain. And there are a lot of drugs available which controls or which stops this particular prostaglandin synthesis. But whereas our curcumin, it acts on every intermediary, about pain intermediates or pain mediators, what we call it as pain mediators. They act on this particular prostaglandin, they act on cytokines, and they act on that particular factor which we call it as the important factor for this particular chronic inflammation is the cells get inflamed and all the NFB cutter, nucleofactor kappa B. This is the particular gene which is activated.
Sir, as you said, it is very effective on every part of your body which is affected by pain. Whereas painkillers give side effects, right?
Right.
Is there any side effect for curcumin?
No, there is no side effects with curcumin. Why? Because it is made up from the turmeric.
Okay.
Does turmeric give you any side effect?
No.
No, because we are daily eating it. Only thing is we are not eating sufficient quantity. The amount of turmeric what you eat, if you eat regularly, that itself is sufficient. But the problem is we are ignoring it.
Exactly.
So the amount of the curcumin available in that particular turmeric is very low. And among that only little percentage is absorbed. Here what we require is 1000 milligrams of this curcumin alone for this particular action.
Okay.
You got to kill all the pain or to stop all the pain mediators, you require 1000 milligrams of that and for tissue construction. Here, see, this particular process of the death of this particular cartilage bone is called, the cells of this cartilage bone leads to apoptosis. Apoptosis is the natural process of death cell. But here what happens because of the compression of the bones or degeneration of this particular cartilage or because of the weight, the bone will be compressed and they leads to this particular cartilage degeneration and apoptosis.
And how much time it will take to gain all the that
action? See, it happens, the action starts immediately. Okay. But how much action you require, how many days you require depends upon the condition. Okay. See, for the damage is heavy, so it takes. But pain will be relieved within short time. There is no doubt about that. Pain, I think, fifth day, sixth day, and I have seen people walking in the next day itself. Oh. But the damage, it takes for months together to repair.
Okay.
And the natural death, what I told you, the cell process, the cell natural death process is called apoptosis. That is fastened in case of this particular osteoarthritis, will be stopped by this particular curcumin. And curcumin has got another beautiful action is it deactivates all the NFP kappa factors. Now the nuclear factor kappa B genes, it just deactivates or switch off all these things, so pain is not there and repair starts. It not only kills the pain, it repairs the joint destruction also. That means two-way action, and it acts on every pain mediators. That is the beauty of this particular product. But the problem with the curcumin is, whatever curcumin you give to the body, anyway I am giving 95% curcumin to you, but whatever curcumin I give, only 5% is absorbed from the body or it goes to the blood, balance it goes as a waste. Here the first challenge is I have to give you 95% curcumin, or then second challenge is I have to see that it is absorbed completely from your body. For that, we are adding a beautiful substance called piperine.
Okay.
Again, piperine. Piperine is extracted from black pepper.
Black pepper. Okay.
The percentage of piperine available in black pepper is only 2.5%. But whereas I am giving 95% piperine in this particular tablet. And I want this curcumin to give its fullest potential action to amplify this particular curcumin. We are giving 3 amplifiers along with the tablet. First amplifier is ginger.
Ginger.
There is a substance called gingerol. We are extracting from this ginger and we are giving it as in the tablet. And second amplifier is galangol. Galangol. See, from galangol there is a substance called galangin. We are extracting that and we are giving it this tablet form. And third beautiful amplifier is holy basil.
Holy basil.
This holy basil improves and it is an adaptogen. That means whatever your body requires, it will act like that. That is called adaptogen. It has got powerful antioxidant property. So it not only amplifies the action of curcumin, and it is what you call, it takes action against free radicals also, which is responsible for chronic inflammation.
Okay.
In osteoarthritis, the final result is chronic inflammation. That chronic inflammation got to be reduced, and curcumin is a powerful anti-inflammatory. These are all the what you call characteristics of our curcumin. And the product is so simple and very good product, and one can take very easily.
And how to consume this product?
2 tablets at a time you have to take. Better you remember a particular time, or best preferably bedtime. If you take before bed 2 tablets, that is enough. It takes 24 hours action. And again, next day you have to take another 2 tablets like this.
Okay. How many days it?
That's what I told you, depending upon the
Depends
damage
on-
of the joint,
Okay.
it may require to take up to 3 to or 6 months, or maybe more number of days to regenerate that particular joint.
And how to approach if anyone interested and anyone need to approach you? How
It is
to-
very easy. See, there is a number here you displayed. Just call to this number. Our telecallers will answer you, and they will deliver the product to at your doorsteps. Or you can go to our website gencleus.com. Or easy is call us and we will deliver the product to you.
Thank you very much, sir, for valuable information and for your valuable time. We'll meet with another episode.
Thank you very much.
Thank you.